Assalamu alaikum viewers and welcome back to our channel. Today in the playlist of oral and maxillofacial surgery, our topic for today's discussion is Ludwig's angina. Ludwig's angina is basically a bilateral swelling involving all the three spaces that are submandibular, sublingual and submental space. So the definition was it is a firm, acute, toxic cellulitis causing the bilateral swelling of the submandibular, sublingual and submental space. Etiology, as far as the causes are concerned, the most important cause is odontogenic infection arising from the mandibular second or third molar, submandibular gland silentinitis, compound mandibular fracture, puncture wound of floor of the mouth, osteomyelitis, and secondary infection of oral malignancy. Now moving on towards the pathogenesis. So as we all know that odontogenic infection arising in the second mandibular second and third molar, it is most probable the spread of the infection is to the submandibular space. So first of all, the submandibular space get involved and infected. Now as we know that submandibular space is connected to the sublingual space by the attachment of the mylohyoid muscle. So the first of all, the same side sublingual space also get involved and the infection spread from the submandibular space to the sublingual space through the posterior attachment of mylohyoid muscle. Now as the sublingual space is also involved and it get infected, this opposite side sublingual space it also get infected because both sublingual spaces that are connected by a loose connective areolar tissue, and the infection it spread from the one side sublingual space through this loose areolar connective tissue to involve the sublingual space of the opposite side as well. Now from the opposite side sublingual space, the infection again spreads to the posterior attachment of mylohyoid muscle to involve the opposite side submandibular space as well. So now both bilaterally, both of the submandibular and sublingual spaces, they are being involved and they are get infected. Submental space is usually the infection spread throughout by the lymphatic drainage. In more advanced cases, the infection can further spread onto the pterygomandibular space, and from the pterygomandibular space it can further spread to the lateral pharyngeal space to involve and get easy access into the mediastinum. The bacteria that are most probably responsible involves the alpha hemolytic streptococci group, the staphylococci and the prevotella group. So the hallmarks, what are the hallmarks of Ludwig's angina? Most importantly, the Brownie edema. Edema of Ludwig's angina is known as Brownie edema because it is woody hard, it spreads rapidly, it is non-fluctuant and it is tender. Second important hallmark is elevated tongue posture. Now, elevated tongue could result in the following difficulties. It will result in the difficulty in the speech, difficulty in mastication, swallowing, and it would also cause drooling. Third important hallmark is airway obstruction. So it could airway obstruction could be due to this elevated tongue posture, or it could be due to the edema of glottis due to the involvement of the hypoglossus muscle. It could result in the hoarseness of voice and stridor and choking. Choking, and due to the choking it is known as the angina. The fourth important hallmark is paucity of pus, that is minimal pus. And fifth and last important hallmark is the toxic nature, the toxic appearance that involve fever, dehydration and septicemia. So now moving on towards the management of Ludwig's angina. First of all, early diagnosis is very much important to diagnose the Ludwig's angina. Secondly, most important thing to manage first is the airway maintenance. It could be done through the tracheostomy, it could be done through the fiber optic laryngoscopy or cricothyroidotomy in case in which that is gross edema and it is very difficult to identify the landmarks. Then we can go towards the cricothyroidotomy. After that, after the maintenance of airway, we will proceed on with the prolonged IV antibiotic therapy that will mainly involve the penicillin, metronidazole, cephalosporin with the beta-lactamase inhibitor. And supportively, we can give the hydration therapy as well, as patient has a toxic appearance, was suffering from dehydration, so we will need to give him the hydration therapy as well. Then we will proceed with the early incision and drainage. Now, incision and drainage could be done in either ways. It could be a cut throat incision. Cut throat incision involves it starts from the one submandibular space to the other submandibular space between the lower border of the mandible and the hyoid bone. But the disadvantage of it is that it produces a conspicuous scar. So therefore, it is not recommended. That cut throat incision, it will cause the conspicuous scar, so it is not recommended. Second method is that we can use two stab incision. Two stab incision we can use in the submandibular space, and one stab incision we can use in the submental space. It is also known as the Hilton's method. After that, we will go on with the drainage. Drainage of the sublingual space could also be drained by the intraoral incision that is made in the floor of the mouth. But we need to be very cautious while making this intraoral incision for the lingual space drainage. We should avoid any injury to the stensons or sublingual gland. They should be safe, and you should avoid any injury to the stenson duct and sublingual gland. And last important step is the extraction of the culprit tooth. So with these following steps, we are able to complete the management of the Ludwig angina. I hope this video will be helpful for you all. Thank you for watching. Don't forget to subscribe to our channel for further updates and videos. Thank you.